Dr. Neelima Kadambi from Bangalore. Dr. Kadambi, a former pediatric surgeon, has refocused her activities on mental health and psychological support. She has worked as advisory board members for Symbiosis Deemed University Asia and for the Swiss Reinsurance Company, and as a medical director for TTK Healthcare Services. She is the founder director of Indranagar Home Care Service and the chief well-being officer of UDG Group and Colors of Life. She has authored a very inspirational book, My Ajji and I, and currently serves as the chairperson of IMA National Committee for Emotional Health and Emotional Well-being of Medical Students and Doctors in India, and as a director of Bell Sante Institute of Functional Medicine and vice president Bell Sante Quality Compounding Pharmacy. With this brief introduction, I welcome Dr. Kadambi to make her points. Please.
Good evening, everybody. Pleasure to be with you. I've been listening in to the other speakers. Wonderful people from all over the world coming together to share their knowledge and information. I'm kind of looking into my crystal ball, you might say, and taking this topic of what's going to be after the pandemic. I'd like to share my thoughts on how I believe this pandemic is going to change the way people look at healthcare and seek healthcare, and the way we doctors deliver this healthcare. So I'm a diehard optimist, and I always look at the silver lining on the gray cloud. So yes, today the pandemic is a big dark cloud, and people are struggling to see when we will come to the end of it. I don't know when, but I know for sure it will end. Nothing remains forever, right? So looking at the silver lining, I say that this pandemic has forced all the people to rethink and believe that health is really wealth, because what we are seeing as the complications and the mortality being highest among those that are already having comorbidities is reminding people to invest in their own health care. And I see a boom already happening in the wellness space. And actually speaking, when we became doctors and we call ourselves healthcare providers, somewhere along the way, the medical profession got reduced to being more of disease managers. And yes, we need to manage diseases and we need to manage trauma and all of that. But preventive and positive healthcare is going to be the need of the hour today and for the future. Because as someone rightly said, this pandemic will end, but who knows what other pandemics can happen. Today, it is reminding people to go back to more traditional and ancient ways, which are wise ways of living in balance, in harmony with our environment, with our nature, and the importance of freshly cooked, fresh food, nutritive food, and keeping a positive mindset, because stress and excessive overwork that has become a norm today is killing immunity and making us more susceptible to any infection. So that's what I see in the future. Younger generations who are learning that this pandemic is causing such havoc are going to be more conscious of taking care of themselves and taking ownership and responsibility for their own health, rather than saying, if I'm sick, I'll go to a doctor. Because today, going to a doctor is something nobody wants to do. And similarly, the healthcare delivery models will also change. In our medical school time, when we had to choose a subject for post-graduation, the glamorous ones were cardiac surgery, neurosurgery, radiology, pediatric surgery, and all those. But I think a lot more students today will be thinking of epidemiology, public health, preventive and social medicine, which was not a very glamorous topic now. But today, it is playing an important role in directing how our healthcare deliveries work. And what we know today as crowded waiting rooms of doctors' clinics and hospitals with huge number of beds occupied is going to change for the better, according to me. And this is not just guesswork, but based on observations and facts, that telehealth is becoming a reality. And today, because of the fear of catching COVID from a hospital setup, people are preferring to do telephonic consults, even telephonic counseling. I myself am a volunteer for the government of India, and every day I do 20, 30 plus cases of telecounseling for newly detected COVID cases. And a lot of them, with the reassurance, can be managed with self-care. Now coming to home care, I know for a fact that many maternity homes and chains of hospitals in India have started the option of doing safe delivery in the home. This was what was happening in my grandmother's time. She was a doctor too. And then we moved to institutional deliveries. But so many newborn babies and women, healthy women who went for deliveries, became COVID positive because of exposure. So now it's like going back to the future. But more than that, I think for chronic illnesses and for lifestyle diseases, those who already have it need constant monitoring. So wearable devices, self-monitoring devices, and telehealth is going to be the norm. And I think that will improve the reach. In India, we struggle with having inadequate infrastructure for hospitals and doctors in the rural population or in the smaller towns. But telehealth will offer this option that everybody can reach a doctor at the drop of a hat. And the cost should also come down because it takes away the need for travel. So I'm seeing that though this has been a terrible tragedy in terms of human suffering and loss of life, in the future, we are going to be seeing a much healthier trend, a more positive trend, and people are going to take better care of themselves, and doctors are going to be investing in wellness and preventive care rather than all of this disease management that we now see. And wearable devices, technology, robotics, artificial intelligence, all of that will play a role.